welcome back. So now that we know the body breaks down into body systems, we know that the body can be broken down and described in terms of its structural organization and the components at each level of that organization. We also need to, in order to prep ourselves for a further study, understand some important terminology that will help us to describe the body. And it will be important for describing the body from an organism standpoint. So if we're describing the body as a whole, we want to be able to talk about parts of the body, but also when we're talking about structures inside of the body and even things that are smaller like the tissues and the cells, to be able to describe in great detail how exactly they relate to one another. So we're going to start with basic anatomical positions. And the anatomical position by definition, V1, is that the body, if you were to describe it, you would describe it in the context that it's facing forward, the patient's or body's hands are at their sides, the palms face forward, and the feet are together and they face forward as well. So that, I think, it's just kind of a baseline. We have to just sort of talk about that at the beginning, and know also that in the context of talking about a patient, so you're describing a patient's abdominal pain or you're describing a patient's injury or something, you're always going to describe it in the context of anatomical position as well. So it just sort of puts everyone on the same page in terms of especially if you're documenting about something about the patient. Other positions that you should be familiar with, the supine position is the body lying completely flat on the ground. Prone, the opposite, face down, lying on the ground. I hope you can sort of tell from my drawings exactly what they mean to look like. I can only do so much with stick figures. Lateral recumbent. Lateral recumbent is also the recovery position. So, in American Heart Association videos where they have they'll do CPR or something, and then they'll have the patient will come back to life, and then they'll turn them on their side. So that's the also lateral recumbent, and I think it's necessary for this terminology in particular. There's not a lot of instances where we're going to put patients in some of these positions, but there's a good chance that you would find a patient in these positions, and sometimes it's useful in documentation to describe how the patient was found in order to paint the picture of the initial scene. The sitting position refers to someone sitting, it doesn't have to be in a chair. I'm going to draw a chair just for the sake of making it easier. But sitting means that there's a right angle at the knees and that the feet are on the floor. So it would be inappropriate to say sitting on the stretcher if the patient's feet are actually touching on the floor. And we'll compare that to semi-fowlers, which would be sort of the reclined position when the legs are actually up and the patient may be sitting back. Lastly, we have Trendelenburg, and Trendelenburg. So it really means that the feet are elevated. So it could be, and it's funny to say this now, but in the old days when we used to backboard people, it would be something like you would put something under the backboard in order to raise and sort of tilt the body on an angle. But now that we really don't backboard anymore, it would be most appropriate to just sort of think of it in terms of raising the legs when the rest of the body may be flat. All right. Next, we're going to talk about some anatomical directions, and some of these terms may be incredibly familiar because they're discussed in EMT class, and some of them may be a little less familiar, and some of them I'm going to cover particularly because they're appropriate for talking about the science, the anatomy and physiology science, and you may not really see them in a lot of other contexts in terms of your paramedic education, but just to be sort of familiar with them if you're reading them in the book or you see them, it would be just useful to know them. All right, so the first one that they're going to mention is anterior versus posterior. So anterior refers to towards the front of the body, whereas posterior refers to towards the back of the body. So you have to sort of think of it in the context that I've drawn it. So the stick figure. So and then I think most of the time you would use these terms to compare two things. So we could say, for example, the trachea is anterior to the esophagus, and we would say that because the trachea in the human body sits directly in front of the esophagus. So anterior, it'd be sort of like substituting in the words in front of, and posterior, it would be sort of like substituting the words behind. Next is ventral and dorsal, and ventral and dorsal are similar to anterior and posterior, but it really means sort of like the back side of the body or the spine of the body, and then the underside or the belly. So it really is more historically appropriate to use these terms to describe a four-legged animal. So I've drawn the stick figure kind of like, maybe a little yoga or something, but on four legs and or on hands and legs. And it's going to become obvious why we use these words for a human, even though we really don't walk around on four legs, because body cavities, which are coming up, are going to, we're going to talk about ventral body cavities versus dorsal body cavities. So it'd be useful to get these words in your mind, but just kind of think of them in that way. And also, I like to draw a dorsal fin on the back of the body because, if you were thinking about an animal that does in fact have a dorsal fin, you would instinctively know where the dorsal fin would go. So if you draw a dorsal fin on the human spine, then you'll be able to remember that that's the dorsal side, and then the ventral side is sort of the belly or the underside. All right, the next one is cranial versus caudal, and this one I think is probably the least used in EMS, but definitely you could find this in the textbook. So cranial means towards the head, and caudal means towards the tail. And so obviously we don't have a tail, but we do have a tailbone. And so I think if you just think of it as like towards the tailbone, but not necessarily towards the feet, that would be a good way of thinking about caudal. Another group of terms that may be more familiar is superior and inferior. Superior refers to towards the top of the body, and inferior refers to towards the bottom of the body or towards the feet. So again, different from caudal and cranial because we're not talking about towards the tail. We're talking now in this case, we're talking about the feet. And we might say something like, the lungs are superior to the diaphragm. So there's a million examples that would be appropriate in terms of using these terms, again, useful when describing the body for documentation and talking about your patient to other people. Next is proximal versus distal, and I'm actually writing these for you because I think that these are a little harder for some people to remember. So proximal means closer to the point of attachment on the body, and distal means further from the point of attachment on the body. So you normally would use these words to describe extremities. So you would say, for example, that the wrist is distal to the elbow, or the elbow is proximal to the wrist. And I think that, again, use of these words in the cases of injury would be the most common or most useful. You might say that the patient has a laceration that is 2 inches proximal to the wrist on the anterior side, or something like that. Next is medial and lateral. So medial means towards the midline of the body, and lateral means away from the midline. There are fewer examples where this is, common, I think, to describe in terms of injury. But you might say something like, let's say that the patient was stabbed in the abdomen. You might say that that the stab wound is 2 inches lateral to the umbilicus or something. But also, I think that you'll find that there's a lot of anatomical terminology, specific to structures in the body that may be referred to in terms of medial or lateral, and another word after it. So you'll find, I think, that it's pretty common. All right, and the very last one is superficial versus deep. I'm not going to draw a picture for this one, but I think that, it's pretty easy to conceptualize. If you think about a laceration, we would consider a superficial laceration something more of a scratch, and something of a deep laceration that extends, an inch or 2 inches, or, some depth into the structures of the body that are injured. So I think, just keep that in mind because it's useful, especially in documentation for certain types of injuries. All right, let's move on and talk about sectional planes. So there are 3 major sectional planes that divide the body, and I'm just going to define them first and talk a little about their context afterward. So the first one is frontal, and frontal basically divides the body into anterior and posterior sections. I would say halves, but it may not be halves. It may be, it could be a third of the body is cut forward, and then the 2/3 are kind of in the back. So don't mind my stick figure. I hope you can kind of see that it's a profile view of the stick figure, and the arms would just be going forward, and then we've just sort of cut so that the face is separated from the back. The next one is sagittal. Sagittal divides the body into right and left components. And again, we could say exactly in the middle If it's exactly in the middle, we would call it mid-sagittal. So mid-sagittal refers to immediately down the midline, dividing the body into the right and left halves, but we could have other sagittal sections that are not midline. So we could be offset. We could maybe pick down the line of the middle of the clavicle and divide the body that way. So I'm going to show you both versions, something that is a sagittal section and then something that would be a mid-sagittal section, hopefully so that you can sort of see the difference and understand that we would only use the term mid-sagittal if we're talking midline, but it's not the only term that we would have a sagittal section. So we've got one that's down the middle and one that's missing just a little piece of the sides. And the very last one is transverse. Transverse planes divide the body into superior and inferior. So this is our traditional cross section. It may be familiar to you in the sense that if you think about, if you come upon, a motor vehicle accident and maybe there was a motorcycle involved and the patient was transected. Transected is one of the criteria that says, we don't have to, there's obviously, this is an injury that's incompatible with life. There's no additional actions that need to be taken. So you could think of transverse in that way. And then, the other important use of sectional planes is imaging studies. So there's lots of imaging studies that are available that will divide the body into these different planes in order to get very distinct and specific views in terms of what may be going on inside the body that we would like to see. All right, that's it for anatomical terminology. Thanks for watching.